views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗛𝗵𝗹𝗁 as we discuss the latest health and medical topics with doctors from 𝗛𝗵𝗁. For a healthier and uplifting lifestyle, tune into Healthline with 𝗛𝗵𝗁 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗛𝗵𝗁 every Monday from 5 p.m. to 6:30 p.m. airing on Sky Cable Channel 224 and on all DTT boxes, simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗛𝗵𝗁 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi everybody and welcome to Healthline with 𝗛𝗵𝗁. I'm your host Nicole Jacinto. Happy New Year's everybody. If you didn't want the last year to end, it's okay. This year might not be bad. It might even be better. It might be the same, And on that note, New Year's is usually when people make resolutions. Did you make a resolution? Like, are you hungover today? How are you feeling? Did you lack sleep last night? That's very understandable because of the celebrations and, welcoming the new year. But in that light, today we're going to talk about health checkups or executive health checkups, and probably particularly those that they have in 𝗛𝗵𝗁 that they have to offer. And today with us here on the show is Dr. Marie Jenny B. Puzon. How are you, Dr. Puzon? Happy New Year.
Hi, Happy New Year. Good morning. I said good morning.
Good morning, good evening, a good day. It doesn't matter. It's New Year, so I guess just
New Year to everyone.
Yeah.
Good morning, Nicole.
How are you today, Doc?
Feeling fine. Starting the year right by feeling fine.
Oh, that's great. That's great. And doctor, okay, so a lot of people make resolutions about health when it comes, they make a lot of resolutions about things in general, but when it comes to health and wellness, they make resolutions. And one of the things that people might say is like, I want to quit this, which is bad for my health. I want to start that. And, there are executive checkups that are given, and not everybody is very familiar with what an executive checkup is. So maybe you can just tell us a little bit about executive checkups, or maybe even your thoughts about getting executive health checkups kind of align with resolutions and all that.
Okay, Nicole. Getting an executive health checkup aligns perfectly with starting the year on a healthy note. Okay, for several reasons. First, it will provide you with a comprehensive assessment of your current state of health. What with recent holidays where, admittedly all of us has indulged a little bit.
Yes.
It will offer insights to the potential areas of improvement. Our laboratory and the diagnostic tests done during your executive health checkup will serve as a solid foundation for setting a background for your resolutions and your health goals for the year. Second, an executive health checkup will also give us advice on the lifestyle modification, nutrition, exercise, and it will guide us, and it will be instrumental in shaping our resolutions. And then by identifying and addressing these health concerns early on, we're being proactive in approaching our health. So this will not only contribute to success of fulfilling your resolutions for the year, but more importantly, it will help in preventing any development of more serious illnesses and health issues down the line. So in essence, an executive health checkup is something that will help empower you with the knowledge and tools needed to kickstart the year. to kickstart
Yeah,
2024.
I love how you said that, doctor. It empowers you as a person, as a patient, and it's instrumental. You mentioned the word instrumental in determining maybe what areas a person should focus on moving forward in terms of how to take care of their health. You mentioned it being like proactive and not just reacting to an illness or a disease when it comes and hits you or you start feeling the symptoms. And I guess like getting a health checkup, even if you're young, is good to get like a kind of baseline of where you were before or where you are now. You did mention it's good to take account of how you're doing now, and then moving forward, you can start using it as a record for yourself, no? And for your doctors also to look at, oh, before you were like this, now this is like this. So apparently nothing has changed that much. You're still okay. Like when you go to your regular doctor for something, that's great, doctor. And a lot of people do make resolutions when it comes to health. You did mention like exercise and stuff like that. And when sometimes, like, I just like to remind the audience, when we say exercise, I mean, when I was younger, I could just like exercise and be like, or I would say like, just lose a few pounds. But exercise doesn't always have to mean like killing yourself. It's over time. Right?
Yeah,
'Cause, like,
yeah, you're right.
you do diets and fads and exercises, that I mean fad diets, and then you lose weight or whatever your goal is for very
Only to gain it back after a few months. Maybe
Yes.
well, I guess as you age, exercising and dieting has become more of a struggle for
Yes.
everyone.
Yes, for everyone. Yeah, we're here to encourage people to have a healthier and uplifting lifestyle, and part of that is your mindset, no? It becomes harder for everyone because, well, your metabolism is slowing down, right? As you get, I mean, please jump in and correct me if I'm wrong anytime or you want to clarify something, and also like, to find the time to do it. The
Exactly.
3 hours you spend in traffic or commuting, you could have spent 30 minutes doing something, and you're just so tired and you have much more responsibilities. But you can find a way to put it in, even if it's just a little. Before you say, no, 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 I want it now, I want it now. But, you can't sometimes. Many times you can't. And thank you for being so encouraging, Doc. I mean, okay, when it comes to, okay, you did mention some of the key benefits of undergoing executive checkups already. You said it's instrumental in determining how you look at your health going forward, not just in terms of resolution, but maybe information for your doctor, no? Whether it's a general practitioner, your family doctor, or anyone that you have to see later on. Um, in terms of health checkups, could you walk us through like some typical components or tests that would happen during an executive health checkup?
Okay, so Nicole, the components of the health checkup varies for the specific demographic that you're targeting. But I'll let you know
Yeah.
let our viewers know as well the typical components of a health checkup. So first, we do a review of your medical history, your family history, and then we do a comprehensive physical examination. And then the patient goes through a panel of blood tests. And depending if you have cardiac risk, we do a cardiac health assessment. That's where your 2D echo, your treadmill stress tests, your ECGs come in. And then we also have lung function tests, we have hearing tests, we have bone scans, we also have what do you call this? We have different imaging modalities that we tailor for your specific needs. So you just have to keep in mind that these tests are differs for every individual. Okay, one individual can have a family history of cardiac diseases, so therefore we advise them to undergo a cardiac workup, or those who have other lung problems. So it really varies, but the typical components would be the history and the physical exam, and then of course the blood test and the necessary imaging studies that one needs. So it's really important that those who want to undergo this executive health checkups communicate openly with their healthcare providers, so as for us to be able to tailor make a package that's well suited for them.
Yes, thank you, doctor. I mean, thank you for reminding everyone out there that it's individualized, but there are some components that will probably definitely be taken, such as, I'm sure, like maybe a typical, and we can go through it by demographic if you wish, if that, I
Yeah.
mean, like what you would probably get. But as you said, the first step is the interview, no? Or basically like doctors and other medical professionals asking you questions and to fill out forms also, and like, okay, do you have a family history of this or that? And then like, do you have, I mean, you'll see on those forms that you check off that people get impatient about, like, but like, do you have a history of asthma? Were you ever blah
Yes.
blah? Have you undergone an operation, or things like that? And that's important
Yeah.
because you want to make sure you're you as a doctor and as a team of actually doctors or medical professionals, that you're making it as how do you say this, as aligned with the patient's status as well, or what could probably, what they probably need to watch out for. So when you talk about an executive checkup, you did mention like, okay, so there definitely will be a blood test, right? Because that is important. Blood test can tell a lot. Would you probably be ordering like a 𝗵 23 just in general for everyone? Is that something that you would order, the 𝗵 23?
Yes, yes, of course, the 𝗵 23 contains, it includes the necessary tests like the lipid profile, your creatinine, your liver functions, your what else?
Yeah, your
Your electrolytes are also there. So this will really aid in determining your present condition, your present state. Like if you have high cholesterol levels, if your triglycerides are high, of course your blood sugar levels are included there as well. So it tells us a lot, and
Mhm.
it helps us in assessing your present health condition.
And with that type of blood test, you need to fast, don't you? Like what are
Yes.
the fasting hours usually?
Usually, the laboratory advises 10 to 12 hours fasting for more accurate results.
Mhm.
Um, they do allow you to drink a glass of water, but nothing really by mouth within those fasting hours. So what we do, Nicole, to make it, of course, to make it easier naman for the patients who
Yeah.
come here and fasted at 10 to 12 hours are super hungry already. We have a satellite laboratory in our area.
Mhm.
So once you arrive here, once you we check all your forms, the first in your itinerary would be your blood tests.
Okay.
So after you get your blood test, okay, you can. So you're more comfortable
Yeah.
going through all the diagnostic tests that you have or scheduled for the day.
Oh, and then doctor, are executive checkups like, can you do them within a day, or do you recommend staying overnight, or is it a variation, like how short to how long can it be? And I know you have a center in Makati Med where that just focuses on executive health checkups, and it's very convenient. I've tried it before. Can you
Correct,
please let me
correct.
know what the typical, just the range of the time that you
All
spend?
right. We understand how busy everyone is, especially now that the year has started. So many things that are scheduled on our to-do lists. So a typical what we do here at the Health Hub would be we have an itinerary for each patient. Okay, these patients, of course, do schedule their executive health checkup beforehand
Yeah.
para mas streamline yung mga processes natin.
Mm.
So,
So it's
all
not
you have
really
to
for
do,
walk-ins, no? I mean, you should make an appointment ahead of time.
Ideally, of course, because you have some preparations that you have to undergo before coming in. But if it's for the basic tests that don't need fasting, then we can do, or we can accommodate walk-ins. But for those with more extensive tests, we have to coordinate with other centers for you to be able to have non-complicated process para dire-diretso yung pag-health, yung check-up mo. So, I would say that all you have to do is, fast, come on time, or like ideally 30 minutes before your executive health check, because you do have some forms to fill up. If everything goes well, walang mga complications or critical results, I can say that you can undergo an executive health checkup for like an average of 5 hours. In our unit we have executive liaison officers. These officers will personally accompany you to the centers, so you don't have to worry about losing your way or being late for your scheduled ultrasound or scheduled x-ray test, because they will accompany you, they will endorse you, they will pick you up after, and then they'll just be with you throughout your health checkup. So
I can attest to that. Yeah, doctor. It's much more convenient, but you're not stressed going from one place to the other. And if you have to wait, you just wait a little. They bring ahead of time also. It's not like they're, rushing you the whole time. So
there
yeah.
is also an option, Nicole,
Mm-hmm.
one-day admission for those who want more extensive tests. Usually these are the patients who also include a colonoscopy in their executive health checkup. So for ease of managing everything, we advise you to have yourself admitted for a day, so you're more comfortable going to your to the centers to do your other tests, and you're prepared during the night for the other tests. Like, if you have to undergo a colonoscopy, your preparation is done the night before. So walang hassle.
Yes, it's actually much easier to prepare for anything like a colonoscopy or other tests if you're there already. Because when you wake up, it can just happen. I mean, they can start. You don't have like, oh my God, I have to rush to the hospital and I can't drink anything. And then, I'm not sure if I cleared out my bowels, all of these things. Some people don't mind. They'd rather spend the night at home, but it can be a lot more convenient. And like, as soon as they'll count the fasting hours for you, then they'll just walk into your room and take your blood and you're like, go ahead, I'm still asleep, kind of thing.
So the process, Nicole.
Yeah, but I'd like to hear it from you. Maybe things have changed. I mean, or they're better even. I've also not just for myself, but I've accompanied other patients there, and then it is very convenient in your health hub. And then having walked us through the typical components, definitely somebody will, if you'll do a chest x-ray, right, with an image of the heart and lungs that you will kind of see there. That's probably really like part of, is that correct? Would that be part of like standard for everyone, no matter what demographic?
Chest x-rays? Yes. You're right. Yes. It's part of the basic 5 tests. The basic 5 would include the history and physical exam, a CBC, a chest x-ray, a urine, and a stool exam. These tests are like the base of all the tests that we have. Some individuals, they just require these tests. So ito, sobrang bilis lang. It would probably only take you an hour or 2 to be able to accomplish the basic 5. But like I mentioned earlier, it's more lengthy if packages are more complete or comprehensive.
Yes. And I mean, it's much more convenient to do the urinalysis there. Like, okay, you're not supposed to drink water. So the first thing we do would be like fast, right? And then get your blood. And then after that, you're like, drink like, I don't know how much water. Then now I'm going to urinate. It's parang you're at home lang though. It's not that difficult. And then If you,
Because we can't really, we don't really advise doing those tests or collecting specimens at home, because we do provide you with a sterile containers for these ones, and of course, beyond 30 minutes, these specimens are really not that
yeah,
uh, accurate anymore.
yeah,
So dapat within the time frame. So
yes,
ideally, we have comfortable restrooms or a comfortable place where you can do this all conveniently.
yeah. Actually, nice, comfortable restrooms I mean, if for those who I'm accompanied overnight, also myself. Yeah. So, okay, thank you, doctor. And then, okay, so we've talked about New Year's and New Year's resolutions and all that. And then, um, do you normally get booked in January for executive checkups?
Actually, this December we are full to the brim
Yeah.
because, of course, I think also for individuals who have corporate accounts,
Yeah.
their HMO has expiration dates.
Yeah.
So naghahabol ngayong December. But
Yeah.
usually we get really booked for like these months, September. It starts in September, then goes to till this end of the year, and then of course January is also a busy time for us.
Yes. Okay. Okay. Well, also a lot earlier on in the show you mentioned that it's a good time after the holidays to get checked also, and people say I don't want kasi I overindulge, but that's probably the best time,
Exactly,
right?
exactly. Mhm.
Because
It will reflect on your cholesterol levels. So be proactive about it.
yeah,
At least you know early on that, hey, this is high. I need to do something about this. I need to
yes,
address this immediately para hindi na lalong tumaas. Para
yeah.
makontrol
I
beforehand.
you know I I ha- I have some very close friends and relatives, and I would often joke around to them because they're like, oh, I'm like dieting or and exercising this week because I'm gonna about to get my blood test. I'm like, why don't you just act normal? You want to know the real score, and they're like, no, but I don't want the test results to come out bad. I'm like, yeah, but if you're gonna go back to what you're doing, that
Yeah,
kind of,
after you get it, you're like
yeah.
back to your old ways.
Yeah, me naman, I'm the opposite. I'm like, sige, let's see, if I do all of this, if I'm still okay. If not, then I know I really have to work on this part or that part, and sometimes I never get to work on it. But my New Year's resolution, one of them will be to really work on those parts. Okay. That it's yeah. On those parts that I need to work on, I mean, wow. Okay. Okay. So doctor, are there you did mention earlier that there are certain considerations, or differences when it comes to executive health checkups for depending on the age or gender, the demographic of the person getting the checkup. Can you name some of the most common or the major differences? Like, I mean, up to you what gender you choose, what age,
Of course, there are considerations in the different for the executive health checkup with regards to gender. For females, of course, they have the mammogram, the breast ultrasound, as well as screenings related to reproductive health, like your pap smears and your referrals to an OB/GYN specialist. For
Mhm.
males, we have the prostate screening, of
States.
course. And then with regards to age, of course, as we age, our health priorities change over time. So older individuals may require more extensive testing, and not to promote, but
Yeah.
our geriatric package is
Mhm.
one of our most recommended package because aside from the typical blood tests that you have, your 12 ECG, your X-ray, abdominal ultrasound, we have also partnered with other centers to do other tests that are needed for this age group. We have the pure tone audiometry. It's a hearing tests, no, for those who are challenged
yes.
when it comes to hearing.
Yes.
And then we
Hearing.
have also fundoscopic or eye exams.
Mhm.
And then, of course, for our elderly who are at risk for osteoporosis, the package includes bone densitometry or bone scans and colonoscopy if they're cleared for the procedure.
Yes.
So
Go ahead. Sorry, doctor.
that's it.
That's it. Yeah. I mean,
Yeah.
that I guess that's if since you have the geriatric package, is it that's new for, I mean, that's the first I'm hearing about it because I haven't brought anyone there in a while, no? And that's great because you kind of already help direct people to what they should be looking at. And as you said, you've partnered up with other centers within Makati
Yes.
Medical Center to kind of to prioritize these patients. It's not just like when they need it. I guess the bone mineral density test is good as you age, no? And then also, I'm sure you'd still look at the heart, of course, always the
Of
heart and
course, it's
the liver and
included. Yeah.
blood test and all of that. And the hearing test is that's the pure tone audiometry test, is that
Yes, it is.
right?
It is.
Yeah.
That's what.
And I would encourage people to get that. This is just my personal thing. Even though you're not yet a senior or you don't consider yourself that old, get it once. It's a good baseline to have. Um, because then you'll be able to tell. And I do know, sometimes I would get very conscious of hearing, like, because I'm like, is it me or is it, sometimes in broadcasting, like people, a lot of us have worn headphones, so we're like, is it me? Is it you? Or blah, or sometimes if someone it seems like they're shouting, maybe they can't hear themselves, or, it seems that they're not participating. And I think hearing is very important. I know it helps activate, I mean, your brain is activated by hearing.
True.
Unless maybe you're born without hearing, then, you found other ways, right? But I think it's a good baseline. This is just my personal reminder to people out
Some
there.
people would be um some people would be uncomfortable about disclosing their hearing problems because they're scared that they might be judged na parang
Yeah.
matanda ka na, you're poor of hearing or something. But really, I keep telling the patients, and of course, those who plan on undergoing an executive health checkup, communication is very important. You have to tell us your concerns. If there's anything that any health concern that alarm you or concerns you, you have to let us know so we can address it.
Yeah.
So yes, this pure tone audiometry is not really exclusive for the elderly population. This can also be recommended for like as you mentioned, people who
Yes. Hi, doctor. Okay.
wear earphones all the time, especially with the adult in call centers who's always on the phone with their
Yeah.
headsets. This can be beneficial to them also.
Yes. I mean, I myself have done it. So, at least I know that, it's okay. Because I'm like, I can't seem to, I don't know if people are not. And I'm okay. Well, the last time I did it, I was okay. So I'm convinced it's just my medication sometimes that makes me like, it's or then I can say, it's it's my allergy or, and then take an antihistamine. I'm like, oh, okay, now I can hear you.
Here.
Yeah. And there's no shame. I know there's a stigma, but really, I believe there's no shame. And apparently, as I got into talking about this more recently, with a lot of people who are like my age or younger, they've been wearing hearing aids for years. And it's not obvious. If you don't want to like mess up your look or whatever it is, it's they come smaller now if that's your only concern. So anyway, that would be a good idea, and it's nothing painful. It's a pretty easy test. Okay, doctor, we just have to take a short break, and folks, stay tuned. We'll be right back. This is Healthline with Makati Med. We're here with Dr. Puson. We're talking about executive health checkups and, of course, their benefits, and we'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto and welcome to Makati Med Wellness Center. Located at Ayala North Exchange, the Makati Med Wellness Center is a warm and comfortable state-of-the-art lifestyle center where executive checkups and services that address holistic patient care and wellness can be done. We have a skin and laser hub, diagnostic imaging, health screening, mind and wellness care, and physical medicine and rehabilitation. The Wellness Center is equipped with modern facilities and staffed with competent healthcare professionals who are committed to deliver premium, personalized, and easy access healthcare services for both adult and pediatric patients alike. This is a great place to prioritize your health and well-being without having to be at the hospital setting. We are open from Monday to Saturday at 7 a.m. to 5 p.m. at the 7th floor of Ayala North Exchange, Tower 1 in Makati City. It is also accessible from the Makati Med Hospital through a bridgeway to Ayala North Exchange. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Wellness Center.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto. We are here with Dr. Puson. We're talking about executive health checkups, and Dr. Puson has been so informative in guiding us through the different steps, what we'll do, and what we will do, what they will also do for us when we're there, especially if you go to the Makati Medical Center Health Hub, because of course, Dr. Puson is from Makati Medical Center, so she practices there, so she knows, I mean, that's the health hub she's most familiar with. Okay, doctor, in terms of getting, we've talked about it as in terms of a New Year's resolution and, getting your health priorities in order and all of that. In terms of like doing it throughout the year, how is it a good idea? To get executive checkups throughout the year, and or how often should you consider getting an executive health checkup? Because some people say, "Oh, I did it like 5 years ago, so I'm okay na." That kind of thing.
Okay, the frequency of executive health checkups really varies or depends on the individual's health risks or pre-existing conditions. But as a guideline, Nicole, it should really just be done annually, once a year. But of course, for people who are at high risk, or if you're being monitored for something, for a specific health condition like diabetes or hypertension, then it depends on your attending physician if they want to do like a quarterly screening. But technically, the executive health checkup for normal individuals or those who have really no health conditions would be once a year.
Once a year, yes. And probably, doctor, you mentioned that it's really up to your physician, attending physician. Maybe if they make you go back quarterly, it's not the whole thing that you have to do.
Exactly,
Maybe,
exactly.
they're just monitoring, maybe you need an ultrasound in you to check your thyroid gland because something seems off in your thyroid function or whatever it is, or maybe it's just to or monitor your sugar or your creatinine or something like that. It doesn't mean that you'll be getting x-rays 4 times a year. It depends, as you said, really.
It depends. Not really. If you're being monitored for something, of course, we don't want to expose any patients to undue laboratory tests or diagnostic tests, because of course these come at a cost. So we have come up with packages that are made for screening purposes. Parang they're packaged together for, like, let's say, diabetic screening package, wherein the human necessary tests lang for the diabetics, like your HbA1c, your fasting blood sugar, your urine creatinine and microalbumin ratio. You're right, like you mentioned, your creatinine levels, spec M would probably be necessary as well to do the screening. So we, as much as possible, make it very cost effective for the patients.
That's great.
And just request for the needed tests and diagnostics if you are undergoing follow-up tests or
So you have that now also. I wasn't that familiar with it before. Like, you can, let's say you have a condition and you're monitoring your kidneys or something. You can have like a package for that. And like I guess I'm also going into now like how customizable is it, no? You did mention it's individualized, but you have smaller packages, or like, let's say, okay, you have this condition and you're monitoring your kidney. So somebody would want you to get an EGFR or a GFR, and then they would also want your urinalysis, and then your creatinine level, and then and then you're also going, let's say, to a hematologist because you've been anemic, or you might be anemic, and then they also want you to get a CBC, or check some other, like, whatever, how your red blood cell platelets look and all of that. And then let's say you're also going, you're just monitoring your heart, or let's say your thyroid gland, or the legs in your veins for the purpose, and you're doing it quarterly or semi-annually. You have packages. Do you have packages that you can customize like that? Like,
the packages here are highly customizable, but for these patients, like you mentioned, Nicole, the tests really for a patient, let's say, who has been diagnosed with chronic kidney disease, would really still have to come from their attending physicians, because they do have specific tests that they want done. And let's not forget that executive health checkups are really more of done for early detection, prevention. But if you have already been diagnosed with a specific health condition, then it still would be best for you to follow up with your specialists.
Yeah, with your
and yes, they will be the ones to provide the tests needed. But sure, if they can present it to us and we have a package for that, then we can help them with that. But really, for people who have pre-existing conditions, their follow-up is still with the attending physicians. But if you are just like monitoring your let's say you're monitoring your cholesterol levels and you want to do it quarterly, or you're monitoring your your blood chemistry in general, then we can do that. We can customize a package that's cost effective for you and for your condition.
Yeah, that's great. I was just thinking, sometimes patients need to go, and of course their specialist, the doctor they're seeing, will say you need to take like these 3 tests, and then you go see your other specialist, you need to take these 2 other tests, and then another one, you should take this test. So like, if I came to you with 5 different tests, I was wondering, sometimes it's a lot more convenient than scheduling it all on your own. But it's okay. But I understand what you're saying, that executive health checkups are more for you to get a baseline and just make sure you're okay, and that is actually a starting point. Just in if you are sick or ano, or afflicted with anything, for you to, I know you don't want to talk too much about it, because also, I mean, I understand you, doctor. You can't, you have so much knowledge in your mind about medicine, and you're not preempting any specialist or any condition that, baka you don't want after the show people just show up there, hi doctor, or I'm looking for Dr. Puson kasi I heard it on radio and saw it on TV, and I just, I want to check everything with you. As you said, it still comes, of course, with the recommendation and from the specialist that you're seeing, or the physician itself.
And even if Nicole, so these people who undergo executive health checkups, they are provided with their with a compilation of their blood tests, their diagnostic tests. All the results come in one booklet, wherein our assessments also are there based on their laboratories and based on our physical exam and our recommendations. So if we do find, let's say, a patient with an elevated blood glucose, which she wasn't or he wasn't previously aware of course, our next action would be to refer them to the appropriate specialist, to an endocrinologist who can handle that. So we're here to help you interpret your results, to detect any underlying illness that you may have, that you're not really aware of, and then refer you to the appropriate specialists.
And I've also seen the specialists go there if there's a concern. If like you referred them, you can say, okay, no, I'll do this. I mean, the patient has a choice. No, I'll do this another time. Or maybe I'd like to see one now because, while I'm waiting for my other tests. Or I've also seen like primary, I guess, some the physician that you see all the time, like let's say it's an internist, like go visit their patients, the regular patients in the health center and go, okay, we'll do this now, o ganyan, so parang it's like a very comprehensive thing, but it feels just more convenient somehow.
This is really more applicable for those who avail of the inpatient packages. These are the patients who are very consistent in doing their annual health checkups. They include their their follow-ups, or if anything, if we see a specific concern.
Yeah, why not, diba?
If they have a concern, let's say, we saw a patch of dry skin while we were doing a physical exam, or noted a mass on the breast, and of course, yung response din naman ng breast center, if they have findings, is very immediate for these critical results. If you have findings on your treadmill stress test, then we can do a referral to a cardiologist right then and there for your concerns to be addressed. That's a good thing about it.
Some of the lesser known benefits of getting an executive health checkup, like, that you can actually see the doctor already, or are there other lesser known benefits? Like, we all know there's a benefit to knowing, as non-medical professionals and people like me, we all know there's a benefit to getting an executive health checkup, but what may be some benefits that are not apparent to us, immediately? Like
nutritional guidance, of course. So in collaboration with our nutrition and dietary services, if the patients can avail of this, so we refer them to the nutritionist, and they prepare health advice and dietary assessments for you. And then there's that health risk education, of course, like I mentioned earlier. If we do find some discrepancies in your laboratories, we give you advice on how to handle it, on how to manage it, how to modify your lifestyle to be able to, prevent it as early as possible. And like I mentioned earlier, early referral to the appropriate specialist. Nicole, we are also looking into, collaborating with other specialists to address the issue of stress management, especially nowadays that that we are giving a lot of focus on mental health.
Mental health,
So,
yes.
those are the mga lesser known advantages of doing an executive health checkup.
Yeah, and there's sometimes it doesn't immediately come to mind to people that like talking about mental health or realizing that this could be caused. I mean, whether it's the behavior, maybe you overeat, or you smoke too much, or you drink too much because of your stress, or whatever it is, or maybe there are even things like you can exercise too much because of your stress, and to the point where you're maybe injuring your body, right? It goes both ways. That these are lesser known benefits that you can explain some. Talk about mental health a little bit, and if the patient is comfortable, you are. Though I think we're doing well we should raise more awareness about mental health. And look, we did have a pandemic, and I know that COVID affected a lot of people. I mean, mentally, psychologically. It's not just it's not just the being stuck at home or whatever it is, and the fear that you could get it, or a loved one could get it and die, and it's not just that, and the loss that people experienced. Even doctors were dying. It's like afterwards, it feels really weird going back into like society and talking about being normal. It's also that's also like I find it weird to deal with, and I think so do a lot of people that I've spoken to. It's different already.
I know. I mean, we're not here to diagnose any mental illness. We're just here to address that maybe this could be a result of stress, and then just helping you address this is already a step towards making yourself better, right?
Yes. There are other stressful situations as well, aside from just that. I mean, there's stuff that could be going on at home. And just to bring it up right before we take a short break is maybe when you're there and and you're getting an executive checkup, you get time for yourself to think about whether you're undergoing abuse, physical or psychological, or verbal abuse, especially to the women. That's my personal message out there. Okay, doctor, we're just gonna take a short break, folks. Stay tuned. We'll be right back. Healthline with Makati Med.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗂𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗂𝗶𝘁𝗵𝗹𝗁. Available for outpatient care services, our 𝗂𝗶𝘁𝗵𝗹𝗁 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗂𝗶𝘁𝗵𝗹𝗁 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗂𝗶𝘁𝗵𝗹𝗁 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗂𝗂𝗶𝘁𝗵𝗹𝗁.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Hi, everybody. Welcome back to Healthline with Makati Med. We're here with Dr. Puson. She is mapuso. I really like Doctor. Okay, so Doctor, we have already talked about how efficient executive health checkups can be for people who, who are very busy. It can be as short as 5 hours. If you want overnighting, okay. I'm sure a lot of people who are working, as you said, there are corporate packages so they're all being used now. um, what advice could you give someone and you know who's maybe hesitant about undergoing an executive checkup, or actually just what do you want to say, like to people out there about health checkups and you know just to help people kickstart. You mentioned the word kickstart a lot earlier on in the show. Kind of kickstart their year thinking about themselves in terms of health and giving more time to it. The floor is yours.
So what I really just want to say is, for those who are hesitant to take their executive health checkups, or those who are interested and want to undergo this, the key take the key points is really to prioritize your well-being. Consider the executive health checkup as an investment. It's the best investment you can give yourself. This will help detect any potential issues that can lead to more effective interventions early on. It will contribute to being given a clean bill of health, especially in the start of the year, will make you more productive.
Yes.
Having that peace of mind that you're okay, that you're healthy, it contributes to your productivity as a person. So next, this executive health checkups are they're personalized. Okay, so it doesn't have to be one package for all. It is a personalized package, so it's very important that you communicate with your healthcare provider. There's no harm in disclosing any what do you call this health conditions that have been recently alarming you, because letting them know what these are will help them make an appropriate package for you. And of course, if you're very busy, make time for it. It'll take less than 5 hours in your day to be able for you to get yourself checked, get all your what do you call this concerns addressed by your doctors. And once you get your results, if there are abnormalities or health conditions that are revealed during these exams, take it as an advantage, for you to work on it early on. And then, like I mentioned, professional guidance. Okay, trust the expertise of the healthcare professionals who conduct these tests, because their goal really is to help you, or to detect anything that any illnesses early on and help prevent it.
Yeah, doctor, that's great. I mean, I what I get from what you're saying is that, if you get an executive health checkup, it's for you. It's great what you said, that it's an investment in yourself.
Yeah.
One, if you come out with a clean bill of health, I mean, it's a win-win. You could say, okay, I have a clean bill of health. Great. As you said,
Exactly, that's the right word for it.
yeah, it makes people more productive. It makes them more confident, and maybe they won't veer so much from, apparently they're doing things right, or and won't veer so much from whatever it is that is in their lifestyle, or the changes. And then secondly, the professional guidance that you mentioned. I mean, you could even get like a advice there from maybe I mean, as you said, trust in the specialist, the process, the doctors, the procedures. The science is there. And if something bothers you, you could always follow up. Like, I am not really satisfied with this test. I don't understand why, ta, 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 ta. And if there are some findings, you said early intervention. I like that phrase because, like, okay, sometimes they're not always gonna come out perfect. You're not always gonna have a clean bill of health, but early detection of anything, even high blood pressure. Sabi mo, high blood lang pala. Oo, pero early detection of that is important so that you can do something about it. Or they say, okay, I'm okay, except that my cholesterol is high. Okay, so then you can do something about that too. It could be as simple as that. Doesn't always have to be scary. And apparently you have also like people who, I guess, help you know with your diet. And it's not just you looking up stuff and being like, I should do this and I should like, some people say it's bad to eat this if you have that, and then it's good to eat this, and you can actually ask a professional.
I've actually used that service already, the nutritional counseling, and they patiently explain everything to you, what the portions, what you have to eat, alternatives. So they're really very patient with that. They will sit with you one-on-one and talk to you and explain everything to you, everything you need to know.
Okay.
So that we offer that as well.
That's wonderful. I think I'll look into that, not just for me, but for others. So I'll be like bringing troops to your hospital. And people will be like, we don't know if we like you or we hate you, Nicole. But okay, Dr. Buson, thank you so much for being with us on the show. It was very informative. It was actually a lot of fun, and it was relaxing. I found it relaxing. So maybe one of my New Year's resolutions should be to keep in touch with you. If you would have your number after
I hope I have convinced you and all of your audience to, look into this executive health checkup. It's like you said, a win-win for all of us.
Oh, I'm convinced, and I'm sure some people out there will be convinced. Hey, members of family and close friends and other relatives, that's a hint for you from Dr. Post.
Nicole.
Because apparently I'm more than the doctors. I'm like 𝗛𝗶𝗁𝗁𝗶𝗶𝗵. And their families were like, why? Anyway, that's just a little anecdote there. Thank you so much, doctor. I do hope that we meet in person soon. And take care. Have a great year ahead of you. Thank you very much for being on the show. Okay, folks.
Thank you, Nicole.
Okay. Want to say hi to anyone? Happy New Year's to anyone?
Happy New Year to everyone. And
Okay.
thank you for giving us this chance to discuss with you the benefits of an executive health checkup.
Anytime, Doc. Anytime. And anything else you want to discuss. Okay, folks. See you again next time on Healthline with Makati Med. Take care and Happy New Year.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those of the station.